Hello everyone. So today I'm just going to go over kind of an overview on my health and well-being project. So my group decided to go over a topic of nursing. So the first slide just kind of introduces some background information on nurses. The first being what their occupation entails. So nurses are typically those who take care of unwell or sick patients. Just more descriptive. A few roles that they do are charting and recording medical history, and that can include vital signs, patient demographics, diagnosis, medications, anything along those lines. Um, and typically, a nurse doesn't just work alone, they work alongside other healthcare staff like a nurse aide or a doctor, depending on the specialty and where they work. So they work with the medical team to coordinate proper patient health care. And lastly, they typically will be a nurse advocate or a patient advocate. And that means that they just make sure that the patient's needs are being met. And if they aren't, then they'll usually step in and take proper steps to ensure that in the future it will be met. My next slide just goes over the difference in a Bachelor of Science in Nursing and then a Master's Science in Nursing. So a BSN is typically a 4-year program, and it's mostly hands-on patient care. And typically, once those who graduate from a BSN program become an RN or registered nurse. And then an MSN is a 6-year program. Typically, they typically educate or found in leadership roles. So based on the healthcare plan, they are the ones who evaluate and can even diagnose depending on the specialty and the doctor that they work under. And then they are called an NP or nurse practitioner. And just some similarities here. Both can be found working in either a hospital, clinic, medical office. Both monitor patient health care, patient's well-being, just to make sure that the needs are being met and that they're taking proper steps to ensure that. And then both use basic tools. So, for example, stethoscope, blood pressure cuff, anything first aid related, they typically use both in RN and NP type of work setting. And then for my next slide, I just decided to include interview process questions that we sent out to nurses. Basically, it goes over what they believe the biggest health risks are in their workplace, what procedure and policies that they would the company has put in place to help eliminate, depending on what health risks they put in the interview. What kind of workplace hazards do they encounter on a day-to-day basis, and what practices do they personally do to help achieve proper safety at work. Even if it's not required, they still do it just to ensure that they're taking the steps they need. And then what procedures are put in place not only protect themselves, but the patients that come in and want to be assessed. And then what changes they would make, if any, in order to achieve a better and safer work environment. So based off of that interview, these are the 3 main concerns that the nurses have. So the first being biological hazards. So that's viruses, your bacteria, medical waste, and then something new that they mentioned with COVID-19. I know that's a new phenomenon. So there are protocols that they're taking to kind of prevent diseases are more, I guess, sharp, you would say. They're taking more measurements to ensure that they're lessening the spread of this disease. And then long working hours, they typically work 3 to 12-hour shifts, depending on the setting, but most full-time nurses are those who work the 12-hour shifts, sometimes 4 days a week, depending on how much they're needed. And another concern that's not as common but does tend to happen more so in a healthcare setting is verbal threats, punching, physical assaults, any of that can be determined as workplace violence. And I decided to do some extra research and find a source that either coincides with this or, offers different, I guess, concerns that other nurses have on a broader scale, because this resource used 200 inputs from nurses. So the source that I used was Journal of Medicine and Primary Care, and the first main concern was needle stick injuries. They're still prevalent today. Radiation exposure, depending on your specialty, not all nurses are exposed to that. It just depends on your profession. Violence, so workplace violence, that's still a common issue today. Non-biohazards, so stress, workload, job autonomy, depending on who you work for. And then that can lead to substance use disorder, which is pretty common in nurses because easy access and the stress and workload of the nurses. And then in worst cases, suicide. So some interventions that I decided to put in place for the 12 3-hour shifts for nurses, just because it causes, the increase in stress, cardiovascular disease, depression, anxiety, and sometimes obesity from overeating and just trying to compensate for the stress and just being fatigued all the time. And I decided to include secondary and tertiary interventions because the likelihood of these establishments, discontinuing these types of shifts is rare. So I proposed some relaxation techniques, some stress management courses, and just EAPs that offer any type of, I guess, assistance, whether it's stress, marital issues, substance abuse, anything along those lines. And just to kind of piggyback off that idea, biological hazards interventions. So these are all primary interventions. These will help stop the problem, just to prevent the problem before it erupts and continues to be a problem. So proper protective equipment, PPE, those are your gloves, your masks, gowns, if it's necessary, just depends on the situation that you're addressing. And then after the use of the equipment, just making sure that you sterilize it properly after each use. And then for those that aren't sure of how to properly sterilize or whether or not they need to use PPE, then I would offer education programs, so that way they are educated and know how to properly use the equipment and just to protect themselves and other patients as well and other nurses. So another idea that I proposed was for workplace violence, and my measures for this is to secure and make sure that the equipment is the best of the best. That way they know that they're taking the steps they need and aren't just trying to put basic equipment out there to prevent those from coming in who don't need to come in. And most importantly, they need to make sure that the staff is trained well, so that way they know what to do in circumstances like these to prevent any further assault on themselves or anyone else around them. And these are both primary and secondary interventions. To evaluate the effectiveness of these interventions requires both qualitative and quantitative data. So after these interventions are implemented, we will send out interviews and questionnaires just to make sure that these people feel like their needs are being met, and that will determine if our interventions are successful or not. And then the use of this is both mixed methods, and that's been proven from data that the use of mixed methods is the best way to evaluate any sort of research topic. So it doesn't have to be interventions, but in this case, mixed methods is the best method of determining what is best. And that is my project. Thank you.